Hello everyone, this is Dr. Praveen Tripathi and with me is Dr. Ashwin who got rank 109 in the NEET PG exam. And Ashwin, first of all, many congratulations.
Thank you so much, sir.
So Ashwin, I was having a conversation with you before we started the recording, and you made a very important point that I want to stress upon in this interview. The role of PYQs. So you have been preparing for some exams. I mean, you are sharing your journey with me from 7,000 in INICT to 600 or 700, which again went to 1,000 and now 109. And then you
Yes,
told
sir.
me that finally the simplest of the things that majority of us take for granted helped you get that rank. So I just want to focus on that first. What was your experience of using the Cerebellum's late night PYQs and midday PYQs, and why you think that it really ended up making a huge amount of difference to your final rank?
Initially, when I was preparing, I only used to go through the PYQs when I was revising a particular subject. So once
Mm,
that subject was over, I used to never go back there, never used to revise those PYQs, even if I went wrong in those PYQs.
mm,
But with these midday custom modules and late night custom modules, I was able to revise again and again, and it stayed in my mind. It imprinted on my mind.
mm,
So finally, I was able to revise it again and again, and that is something which has created an impact on me in my rank.
mm,
That is what has helped me to shift from 500 or 700 to 100.
mm,
And I would advise every aspirant
mm,
to not procrastinate on PYQs, not to take them granted.
mm,
You
mm,
should definitely revise it even in the last few 20 days before the exam.
mm.
That will definitely change your rank.
And Ashwin, sometimes students think that PYQs whenever they'll get time they'll do it, but even completing PYQs is not so simple. Especially if you start doing 10 years of PYQs, then you end up covering almost everything. Like in Cerebellum, we give very old PYQs also, which came in 2015. So something that was asked 10 years back is as good as a new question. What would you think about it?
So, but actually, many people say that 10 years back the line, the guidelines were different, and maybe the PYQ does not have any bearing in the present time. But this year, I noticed a PYQ which came from 2015 or 14, and it repeated the same sentence. The same sentence had repeated exactly like that.
Mm,
It was regarding choking on a peanut. And that had appeared previously in 2015, and most of the other apps actually start giving PYQ papers from 2017 or 18. So they
mm,
miss out on these papers.
mm,
I
mm.
was fortunate enough to see that question and I was able to get it correct in my NEET PG exam.
That's wonderful.
So definitely these 10 years, it might seem hectic, it might seem a lot, but it is essential during your preparation. It is very, very essential.
And I keep on saying that it's the lowest hanging fruit. Covering 10 years of PYQs probably would take less time than covering your rapid revision, even BTR, main videos. All these resources you have to do or you have to do to some extent. But PYQs is something which is much lesser and would be much more, as I said, it would give you much more returns than anything else. But
More
unfortunately,
rewarding.
yeah, more rewarding is the right word. Yeah. But unfortunately, this procrastination for PYQs is a continuing saga. I've been seeing for 10 years.
And I guess many students consider that, oh, it's very simple. We have already went through it in theory, but they
Yeah,
never think about the practical aspect. When it comes in the form of a question, most students won't be able to comprehend what is being asked.
right.
When it comes in the form of a question, we actually think using our minds, and then we come to a question come to an answer by eliminating the options. That art only comes through practicing questions.
Right.
And what is better than practicing the questions which have already come for the exam once?
That's very true. In fact, after this exam, Ashwin, everybody was saying that this exam was very easy because the questions appeared familiar. But look at the
Yes.
results. The results have not changed from the last year. So it was a pseudo easiness of the paper, if I may coin that word. It appeared easy. It was not so easy. They have twisted it a bit.
Yes, they have twisted it. With one word, an answer can change, and that is what this NEPG has shown. Is what I have felt.
Mm,
A simple question, whether the child was unconscious or the child was
mm.
just gasping for his breath, just changed the answer of that question.
Ashwin, when we do interviews, we usually talk about the strategy and all, and it becomes very repetitive. I'm very glad that we are focusing on a particular aspect of the preparation that students tend to ignore and that can have a major impact on their results. So anybody who's watching this interview, I mean, Ashwin is a living example of the fact that something as simple as PYQs can take your rank from 700 or 800 to 100. Of course, you need to have that kind of content, that kind of knowledge to get till rank 700. But then this is like the cherry on the top. Ashwin, one another thing that I want to ask you, AIMS Bhubaneswar is known for a hectic internship. The internship is not so simple. How did you manage? Is that statement correct, or is it an okay internship?
Sir, it depends on the year and the batch of students which are passing. In my batch, out of 100 people, roughly 80 or slightly above 80 interns were there. And
Okay,
in my group, there were supposed to be 25 people, but there were only 19 people. So we had a lot of work to do. The
okay.
division was not proper. So it was difficult for our batch, is what I have felt.
Mm,
And preparation during internship is a bit difficult. I haven't prepared much during my internship. I started basically preparing post internship,
mm,
and that too I didn't have a clear guidance on how to prepare
mm. So,
because I had a lot of resources.
sorry. So, if I may ask you, your base knowledge from your MBBS years, how much difference did that make? Because if you are starting very late and if you're getting a couple of months only, uh,
Uh, Sir, that I'm thankful to my AIMS Bhubaneswar Institute because from second year onwards, pharma papers don't seem like pharma papers. They seem like medicine papers.
okay,
So
okay.
that plays a huge role. That played a huge role, definitely, no doubt.
Mm,
When they ask a question on drugs on heart failure, they present it as a clinical question, and
mm,
from that point in time itself, we start thinking clinically rather than pharmacologically. So
mm,
that has a bearing. That has a bearing. I agree. But then the preparation also matters.
mm,
If you keep it rusty for such a long time,
mm,
you're
mm.
bound to lose that touch. So
Yeah,
yes, preparation matters, but our institute was very keen on making us approach things clinically rather than theoretically.
I understood.
And we had a very good exposure during our emergency
Mm,
postings, our medicine postings, our surgical postings, that we got to see a lot of cases, and these cases stick to our minds. Most of them stick to our minds, and that has helped definitely.
wonderful. So, Ashwin, thank you for talking to us. I think you made a very valid point in this interview. I hope more and more students watch it. And what next, Ashwin? So, what branch are you planning to take now?
I'm planning to take general medicine, but I haven't decided which college. I'm
But,
still confused about it.
with your rank, probably most of the colleges are within your reach now.
Yes, sir.
Probably we'll see you in Delhi. I think you'll definitely get Delhi colleges, right?
Yes, sir. Yes, sir.
So, wonderful. So, hoping to see you sometime soon. And again, many congratulations for this stupendous result. And thank you for teaching your students and telling your colleagues how to approach an exam. Thanks a lot, Ashwin. May God bless you.
Thank you, sir.